I'm sure I'm gonna get blasted a lot just by saying this. Okay, and my teeth looks pretty okay, I guess.
First of all, thank you so much, man. You given me your time, and it's been a long time since I've seen you. Let's start with our conversation. Actually, I invited you because I was talking to a couple of my friends, and we were having a discussion about hygiene. And one of the things that was always you can say like frustrating for me is like sometimes when you're sitting with another person and there's a single hair coming out of a person's nose and you're sitting over there and you want to just pluck it but you can't because you don't like you're not that close to somebody that like, but it's always itchy. And same goes to a lot of things when it comes to hygiene. Like there sometimes you're sitting next to a person and there's a bad breath coming from their mouth, and
Right.
it's very difficult for you to sit next to the person and he's speaking and there's like bad odor. And a lot of times it's from people who are past certain age. Like for example, for me, if I'm sitting next to a person who's like my father's age, I can't tell him that like please don't talk, there's a bad breath coming in. But it's something that I feel like people should notice, and if you're not going to realize it, and if people are not going to tell you, you will not know, and you can work on it. But at the
Right.
same time, as a dentist yourself, what are the best practices you feel that somebody can do for that specific thing?
Well, for me, it's the very boring and basic oral hygiene, brushing and flossing. And these two things is enough, really. It's really just enough for anything to do with the longevity of your any treatment that you have in your mouth, or even your basic oral hygiene. This two is just good enough. I know in the market there's a lot of things like mouthwash and what else? Cake and all this kind of thing. There's no harm, but for me, I'm sorry to let you down, but it's the boring, correct toothbrushing and also flossing. These two is just enough for everyone, really. Yes.
Oh, what about flossing? Like a lot of people, they have this misconception. Maybe I don't know because I'm not a dentist. I can say for sure, but there's like a misunderstanding that whether flossing is actually good for your teeth or bad for your teeth. Some say that it creates a gap in your teeth,
Oh, fuck.
and then
Yeah, all the time.
yeah. So and then some people are saying that like if you don't do that, then there will be tar which will be stuck in your teeth or like whatever food, and you can't get rid of those two. So can you clarify on that? Like what's the, like, is it okay or not?
Okay, I floss every day. Okay, and my teeth looks pretty okay, I guess. It's not filled with gaps. No, I really think that it's really funny when people think how flossing can create gaps, because the floss, if you see, it's so thin. It's so thin. Okay, and a lot of times it's because people think that they're hurting their gums because they're doing it incorrect, where they are probably jamming it too hard into the gums. And probably the technique's incorrect. Now, I would love to show you how to floss, but it's quite difficult to do so in a podcast, right? Yeah. So actually flossing is really, why is it necessary? Because brushing alone is only 60% cleaning your oral cavity. The rest of the 40% is actually missing, and you need to floss, and everything is in between your teeth. Your brush just couldn't reach them. Just clear.
What about the two different types of floss that I'm seeing in the market? One of them is the thread, and another one is like the stick.
The handle? Yes.
Yeah. So which one is better, and like what's the difference?
Which one is better? The best one is the one that you use. Okay, as long as you use them, is the best for you. Okay. Of course, the handle one is easier for anyone who have difficulty in controlling the floss. Personally, I like to use the traditional, the one where you pull out a thread and then
It looks cooler.
For me, it's easier. Okay, but of course, one main difference that I find it's been a while I use the one with the handle, because I find it thicker than the one with the conventional floss. So it's make it more difficult to go in between tight spaces. So that's for me. All right. It's been a while. So correct me if I'm wrong. I'm not in touch with the handle floss in the market. Probably they come up with a thinner version. I don't know. But I've always been using the conventional thread type of floss. And for me, it works just fine. As long as you get used to it, you probably just, you can just done flossing in under the minute.
What about cleaning the tongue?
That is important too. A lot of times, when you talk about bad breath, a lot of people, besides teeth, teeth brushing, cleaning the tongue also plays an important role because a lot of times there are a lot of gunk on top of your teeth, on top of your tongue. So gentle brushing using your brush or a tongue cleaner will actually help you quite a lot. Yeah, if you want to control your oral, bad breath, if you have any.
Well, is it okay to use the same brush on your tongue and teeth? Because for me, like I'm sort of a person who is very fussy about certain things, right? Like for example, even when I'm as a guy, I shave my beard. I'm not gonna use the same thing in my nose or on my ear. So I have a different one for my ear and my nose, and I have a different one for my face, and for private parts is separate. I don't
Right.
like to mix them. What about
Right.
for the tongue and the teeth? I don't know. Is it
Now, if you don't use a tongue cleaner, you can always use the same brush. Some brush comes with a tongue cleaner at the back.
Yeah.
So the brush is in front, the tongue cleaner is it. So it's like a rubberized area where you can use it to clean your tongue. So some toothbrush actually comes with that kind of design. But if you don't, using the same toothbrush on your tongue is just fine. Yeah, because you are supposed to change it every 2 months anyways.
yeah?
Unless you don't change it, okay, then of course you are harboring a lot of bacteria in your toothbrush.
Yeah. What about mouthwash?
Okay. Now this is a very controversial topic because a lot of dentists will advise their patients to use mouthwash, but me personally, I don't encourage my patients to do mouthwash on a regular basis. Alright. Simply because I would advise you use mouthwash unless you have ulcers or sore throat or you are undergoing surgery, you can't brush your teeth fine. For a short period of time, mouthwash can help. Okay, you have active infection, mouthwash can help. But on a regular basis, I normally don't encourage my patients to use mouthwash. The reason why is that for me, I will equate mouthwash to like the use of antibiotics. I'm sure a lot of people nowadays, they wouldn't want to use antibiotics because antibiotics are not only kill the bad bacteria, but also kill the good bacteria. Okay, so nowadays, the issue on gut health is very, very, how do I say, very, in the trend. Everyone is talking about gut health. The gut health starts at the mouth. So in our mouth, we have millions, if not billions of bacteria, and we need that. Okay, by using mouthwash, you are killing by killing a lot of all the bacteria is actually doing more harm than good because your gut actually starts from your mouth. Digestion itself actually starts from the mouth, and you need a good amount of good bacteria in your mouth to start a good gut health. You know what I mean?
Yeah. Yeah, one of the things that I have always talked to people, a dentist, when I went to the dentist, he mentioned that like when you can use it maybe once or twice a week, but regularly it is harmful. But also like on a certain occasions, he said that like it's okay if you have some sort of medical condition, it is okay to use it regularly. And for me, what I thought that it is good for me is like for example, like at night I will just brush on the day in the daytime also I will brush the teeth. But when I wake up early in the morning, right, for before the breakfast, then I will use the mouthwash instead of doing instead of brushing my teeth.
Okay.
Yeah, I mean, maybe I'm wrong, and and I found that like a lot of people are doing the same thing, that instead of over brushing, because like before going to the bed you're already brushing the teeth, so why do you need to brush the teeth in the morning as well? But of course, like when you sleep, when you wake up, then there is some sort of a bacteria in your mouth, right? And so what do you do? If you brush it again, then it feels, I don't know, like waste. So you rather gargle your mouth or maybe do a mouthwash. I feel more better if I'm using a mouthwash because it feels more minty and it feels more clean, I guess.
Okay, yeah, I get your point. I get your point. Maybe with my patients, not brushing the teeth in the morning, but normally it is a good practice to brush after you eat because you don't want food to get staying in your mouth for too long, and that starts all the bacteria. Then you will start to eat things go food in your mouth and causes acid. Right? So you're right. So a lot of people ask, I brush my teeth before I sleep. So when I wake up, it shouldn't be dirty, right? If I'm not eating in my sleep. Right? So a lot of people think, okay, I probably sleep brushing in the morning, it's fine. Okay, you can, in fact, a lot of people actually, even myself, practice that I eat my breakfast without brushing my teeth, and then I brush my teeth after I eat my breakfast. You know what I mean?
Yeah.
It's so that I maintain a clean teeth after breakfast all the way to lunch. So lunch, so ideally you want to brush twice a day. So once in the morning and once at night. So sometimes the people can't have the luxury of bringing the brush along to do so after breakfast. For the habit is brushing immediately after you wake up to get that fresh taste. It's nothing wrong really. You can't be always how to say, I will always encourage people to brush at least twice in a day. Right? Because whatever that is not clean during the night before can be clean in the morning. Does that make sense? Right?
Okay.
So now you may not believe this, okay? Actually, if you we do not need to brush so many times in a day, okay? But I'm sure I'm gonna get blasted by a lot just by say this, okay? But as long as you brush really well, really thoroughly, okay, like probably training is 30 minutes, actually, you can only do it once a day is good enough. Unless if you do it really, really thoroughly. But we do not encourage this because this kind of practice is not feasible. People do not know what is thorough enough, what is good enough. Therefore, to make a habit that's easier, we always encourage twice a day, at least 2 minutes a day. 2 minutes is time, sorry. 2 minutes is time, twice a day. So this kind of a simple practice, simple habits can be easily adopted by the majority of the public.
I actually wanted to ask you, what is your opinion on the Invisalign and the normal dentures? Yeah, braids.
Nowadays, for those people who doesn't know what's an Invisalign, it's a invisible or removable type of braces. We call it aligners, clear aligners, where we can easily take it out and put it in to enhance the teeth. Alright, we take it out where we eat, and then it's easy for you to brush your teeth. And you will wear it for the next at least 23 hours a day. Okay, so we have in here is that the plastic that we wear slowly changes the alignment of the teeth to the desired outcome. Comparable to the traditional braces, mechanism actually of both results is the same. The idea is to move teeth. If you do not have concern of aesthetic where you don't mind having wires and brackets on your teeth, actually both works really well. Of course, Invisalign is not cheap. It comes in a premium price. It used to have limited cases that it can be done, but nowadays, a lot of cases can be done using Invisalign already. So it's really depending on how skillful is the dentist. Whether some people may still be comfortable using the traditional option, okay, simply because it gives them more control. Whereas the Invisalign, it is more on the lab. The result is it's lab generated. So the end result is lab generated. It may or may not achieve the kind of result. Okay, it's predicted, but the prediction may not be 100% correct. So of course, this in the end, it also depends on the dentist how skillful he is to detect whether, hey, look, the plan is not working, so I need to rearrange or change my plan again in order to achieve a certain outcome. So in Invisalign, there's a lot of prediction, okay, whereas the traditional type, there's a lot more control, whereby the dentist is more control, a little bit more force here, a little bit more wire here. So the traditional one basically more control. So it really depends on the preference of the dentist, what he or she wants to use. So for me, Invisalign, whether you use Invisalign or use traditional type, it comes down to your preference. Are you okay with wires if I get them out? Or do you want more comfort? That's all you choose one or the other. In the end, it's up to the patient. It's not really which is better or not.
I think
Yeah.
think a lot of people are trying to go for Invisalign these days. People who I have actually talked to who are actually in my field of work. When I say my field of work, I'm talking about people who are in media or people who are working in maybe as a social influencers or people like that. It's not just the look, it's also that it affects their voice, you know. So with braces, they feel like they are unable to give the right voice tone, maybe, you know.
Not so much of voice. I think what you mean is the speech. All right, because when you have the torsion type of braces, it makes your lips fuller. Okay, like something is pushing your lips up. All right. Yes, it takes a while for the patient to get used to. Okay, once you get used to, actually your speech comes back to normal. I understand where you're coming from. Invisalign is very thin. Okay, much it's not so bulky on the lips. Therefore, the speech is not so much affected. I wouldn't say that the voice will be affected much. It's just the speech. Because when I was younger, I did the traditional type of braces. So I do remember that because it makes my lips fuller, so I talk weird. But after a while, after about 2-3 weeks, once I get used to it, or need to get used to it, it's fine. Yeah.
Is it that you got fine or you felt normal because you got used to it?
I think I get normal because I got used to it. It got normal because I got used to it. Initially, of course, it's very uncomfortable. You feel weird. You talk funny. That happens.
Yeah.
So yeah, I get your point. In Invisalign, you don't have that that disadvantage. It's very natural. You feel more natural. Maybe it's a little bit bump here and there, but you won't get bulky.
Coming back to your career, you know, like there's always some sort of misconceptions about people who are going into medical fields. When it comes to certain types of doctors, I would say, like I would generalize because, you know, like some people get offended when chiropractors are not called doctors.
Yeah, I'm not a doctor too, you know, that's what you were saying. You're just a dentist.
Yeah, so that's why. Of course, but of course, like to be a dentist, you need to go study in medical field as well, right? I'm guessing, right?
Okay, of course, there are different schools in the world are training differently. So, I graduate from Malaysia. So, in the Malaysia university, we actually for the first 3 years, we do learn about medicine, part and parcel of medicine, even drugs and whatnot. Mostly focus more on the chest, above chest, so they take at the chest area. Okay, we call it upper body. So we are all focused on the upper body. Okay, therefore, we do have knowledge and very focused on the head. We are very focused on the head, the nerves and the blood vessels and whatnot, and the muscles around the head. Yeah. Not a full-blown medicine kind of curriculum, but definitely we are not lacking of, if we talk about upper body portion, from the thorax to the head. So we are trained or we learn about this in our dental school.
So after O levels or A levels, you directly go into dentistry, or is it like MBBS and then dentistry?
For us, we after A levels, we will go into dental school. Yeah.
Dental
So
school.
MBBS is actually medicine. For us, for ourselves, ours is BDS or PGS. In the US, it's called DDS, dental, and like DDS are something dental surgery. Yeah, doctorate of dental surgery and medicine in US. Or Malaysia is Bachelor of Dental Surgery. So it's just a different title. It's only the same.
I'm sure like everybody has their own reasons why they want to become a dentist. What was your influence? Like what glorified dentistry for you? Was it the money?
That was life issue about, okay, I want to help people understand things. I'm not that noble. But my reason of being a dentist is actually quite sad. I mean, I don't, coming from an Asian family, okay, I'm Chinese, right? So my parents were all Chinese. So I'm sure in Pakistan, living in India, okay, every family will want one of their children to be a doctor, correct?
Yeah, correct.
Right, either a doctor or a lawyer or engineer, these three types. It happens. Okay, so in my
Every
family,
child want.
every child one, right? Yeah, at least one in the family. So my academic was not bad. Okay, it was pretty good. My father had hopes in me, so he saw a doctor coming in the family. So he wanted me to become a medical doctor, but I have no interest in becoming a medical whatsoever because I know the stress level. I am not willing to go through all the how many hours of on call and whatnot. I'm just not willing to go there, right? So for me, one of the reason why I become a dentist because the next best thing of becoming a doctor, and also you get the title doctor is actually a dentist. So nothing noble, right? Nothing noble. I want to be a dentist because I want to help whatsoever. Okay, but for me, it's nothing noble. It was just purely, I don't know. You want to call it accidental or what? Yeah.
So it's something like mass comm for a business students. Huh?
Something like that? Yes, if it, because you can't become that, therefore the second best option is this.
Yeah.
That's my story. I'm sure, a lot of great dentists out there, they have their own reasons. For me, I do enjoy making people beautiful, or especially, I do aspire to be a aesthetic doctor because I like to do surgeries, how to enhance facial features. But because I'm not a medical doctor, that's why I focus more on teeth. So with that also, I can actually change a person's teeth alignment and also face, right? Especially because I do work with a lot of children. Children actually, if you start early, you can actually, I, I see the potential of helping children to achieve a really beautiful face when they grow up. So it's achievable nowadays. So I can say that, somehow my dreams do come true. I'm making people more beautiful right now. Mm-hmm.
So somehow nobilizing your cause.
Yeah, in a way, yeah. It was not my first reason, but somehow it became like that.
That's nice. That's nice. I feel like this is another reason why you are able to balance your work and your social life as well. Because I see
Right.
you are quite active in other parts of your social life. You were quite active in working out and going to the gym as well. Now I don't know, but now you're into other
You.
things.
Yeah.
But at least now you are quite active in other things as well. I mean, you're doing sometimes you're doing some sort of modeling and stuff like that as well, right?
I still do work out, Faizal. I still work out. I still go to the gym, just not CrossFit. Okay, CrossFit is not for everyone. For me, CrossFit is just very taxing to my body. So I do, body, what's that? Weightlifting. Weightlifting is very important for like healthy aging, right? Because you need to maintain your muscles or at least build up your muscles. Yeah, I am a part-time musical theater actor. So that's because that's mainly of my hobby. My interest. I've always wanted to. I like to sing. I like to act. Therefore, joining a musical theater, a professional, what do you call that? Professional production company. All right. Whereby I have a chance to perform in various countries, like Singapore and Indonesia. Of course, it's Malaysia or different states in Malaysia. It's something that I enjoy doing. And also, I'm very interested in functional medicine. Functional medicine is a type of medicine, is an alternative medicine where we try to treat um problems at the root cause. Okay, we don't just mask aside the symptoms. I'm very interested in that. Okay, so for me, I'm very interested in helping people on combat obesity. So that is mainly just my interest, and I try to, just because I'm a working professional doesn't mean I have to let go of all these interests. That's my also advice.
I think this is very important that because at an early age you decided that you want to have a good work and life balance. That's why you probably decided to become a dentist as well. Like you mentioned that it is not
Yeah.
as stressful as becoming a
Medical
proper
doctor.
medical doctor.
Right.
And then you are trying to do other things, whatever are your interests as well. Do you think that it is really important that decides at a optimum age, I would say, to organize their plan on how they want to develop their career to have a proper life and work balance, or somebody who has like a very strong goal in mind when it comes to career, then of course it would be very difficult for them to create like a life work balance.
There's no right or wrong. This just depending on what is the person's goal and achievement. Okay. Back in the days, I think we're about the same age today. So back in our days, our parents would say work hard. It doesn't matter. Work hard and enjoy later. Okay. Nowadays, when I heard Gen Z or millennials, I'm so confused with the terms nowadays. They're always about mental health.
Yeah.
Mental health. Mental health. Okay, I try my day. I need my mental health. My mental health is affected. Yeah, look great. There's no right or wrong. Honestly, I do believe that nowadays, because mental health is important. Because nowadays a lot of depression, people easily burn out. Okay, and work from home is not. It's simply to work for 12 hours a day in front of a computer, okay? Because you are not bound to the office time anymore. So, I do believe a good work-life balance is important because we can't. Our life is not meant to just work for goodness sake.
Yeah.
Yes, the money is important, right? But there was a meme, or there was a article that I read. How much can you earn to start enjoying life? Like, how much is that? Right? How much is enough for you? If it's 100,000, is it enough? Some people think, oh no, 200,000 is better. Oh, 3,000 is that? Is never ending. So I guess but I will float your boat. But personally, I don't want to look like I'm 50 at the age of 30. Okay. So that's why work-life balance is important for me, where I get to focus on my health, focus on my social circles, focus on myself, not just career.
Yeah. Before we end the conversation, I mean, is there something that you would want to share? Like, if you are an activist for something, if you want people to actually work on something on themselves, or some advice on dental issues?
I do not want to talk about teeth. I do not want to talk about teeth. For me, I think people should they should learn to love themselves. It is a very random statement. For me, tactile learning yourself is sometimes can be seen as a very selfish act. But actually, it's not, for me, it's quite selfless, because once you learn to love yourself, you are ready to give love to others. So for me, it is not as selfish as what people think. It is actually quite selfless. Once you are taking care of yourself, you will start to take care of other people. So what I mean by self-love is like taking care of your own health first, and then you have the energy or you have the power to just take care of other people. A lot of times, right, people think that I need to dedicate all my time and all my energy to a certain work or a certain people, but they neglect themselves a lot. So that's back to our topic of work-life balance. Living yourself doesn't mean that, I don't care about other people, okay, their lives is not my life. No, it basically means take care of our own health first, our own means. Only then we start to pour out to other people, we start to give. So I guess that is a good advice to stay advice that I think people should live by.
Yeah. Thank you so much, man. I really appreciate your time. It was a very fun and interactive conversation. And I hope I can bring you on again next time on performance arts kind of a topic.
I'm glad. I'm very grateful for your, that you come and invite him to your podcast. It's my first time though, really. I never
You're a natural actor.
Thank you.
Thank you so much, man. I really appreciate it. Have a nice day, man. See you.
Thank you. You too. Ciao.